Mayo Clinic cancels Medicare Advantage for 2026.
Last week, I told you about 30 hospital systems across the country who have said no more Medicare Advantage. Now, we're going to zero in on one. Imagine receiving 70 letters in 1 month telling you that your doctor will no longer be in your network next year. That's exactly what happened to Shannon and John Hendricks in Rochester, Minnesota, 2 for each of their 35 Mayo Clinic providers. After moving from Seattle specifically to access Mayo's world-class care for Shannon's double lung transplant, they're now facing the devastating reality that their insurance will no longer cover the medical team that's been keeping her alive. And they're not alone. This is happening to tens of thousands of Medicare beneficiaries across Minnesota and beyond. And it's part of a growing trend that every Medicare-eligible person needs to understand right now.
Mayo might be the best healthcare provider in the nation, but what does that mean when people in its home state don't have access?
People who can afford medical care will continue to receive it. Those who can't will continue to struggle for survival, both medically and financially.
During this year's open enrollment period, let me explain what's happening. Mayo Clinic, one of the nation's most prestigious health systems, is dropping out of network for most United Healthcare and Humana Medicare Advantage plans starting January 1 of 2026. This affects Mayo's facilities in Minnesota, Wisconsin, Iowa, Arizona, and Florida. And here are the facts. In Minnesota alone, where 65,000 seniors are enrolled in Medicare Advantage plans, this change impacts thousands of beneficiaries. In Olmsted County, home to Mayo's flagship Rochester campus, seniors have had 5 Medicare insurers to choose from for 2025. Next year, they'll just have 3. And of those 3, only 2 will keep Mayo in network. They're Blue Cross Blue Shield of Minnesota and Medica, a very small company. But this story is bigger than just the Mayo Clinic. As I've covered, it's part of a nationwide crisis in Medicare Advantage that's unfolding right now. You see, Minnesota is seeing the second largest drop in plan availability across all 50 states. Copays are going up, benefits are being skimmed down, and Kelly Jo Griner, the Medicare program director at the Minnesota Board of Aging, describes the emotional toll. She said, "It ranges from pure anger to tears. It's really a range of extremes that we're hearing." Minnesota Aging Pathways, the senior linkage line, has been receiving more than 1,000 calls a day since open enrollment began, the largest increase in call volume they've ever seen in their history. And it's not just Minnesota. UCare, which insured 158,000 seniors, representing 26% of the state's entire Advantage market, was forced to stop offering Medicare Advantage plans entirely due to a ruling from CMS earlier this year. Several Minnesota health systems went out of network with Humana's Medicare Advantage plans, and Duluth-based Essentia left United Healthcare's Medicare Advantage network entirely. So why is this happening? Well, Humana issued a statement explaining their position, quote, "When providers require significantly higher reimbursement rates compared to original Medicare, it further strains our healthcare system. Ultimately, it costs patients more in the end, as seen in the healthcare Medicare Advantage premiums in Minnesota," they said. The Mayo Clinic responded, and they said, quote, "A substantial portion of the care that we deliver each day serves patients with Medicare, but they stopped short of addressing the specific financial disputes. What we know is this: there's a fundamental tension between what Medicare Advantage plans are willing to pay and what prestigious medical centers like the Mayo Clinic and Johns Hopkins, as we covered earlier, and more, are able to charge for their services. And seniors are caught right in the middle. And here's what it means if you're affected. If you have a United Healthcare or Humana Medicare Advantage plan, and you want to continue seeing Mayo Clinic providers, you have 3 options. Option 1, to switch to one of the remaining Medicare Advantage plans in Minnesota that will keep the Mayo Clinic in network. Again, that's only Blue Cross and Medica. Option 2, return to original Medicare, Parts A and B, and get a Part D drug plan, and get a Medicare supplement to go with that. The Mayo Clinic specifically suggested this option in letters that they sent out to all of their patients in Florida and Arizona. And then there's option 3. If you have serious health conditions and have established relationships with your Mayo providers, you technically could stay in your current plan, but you'll face much higher out-of-pocket for out-of-network care. And as Mayo has made clear, they may not even schedule appointments for patients with out-of-network Medicare Advantage plans. But here's the critical thing to understand. Provider networks have always been a limitation with Medicare Advantage plans, but the scheduling block that Mayo implemented made this issue even more serious. You might technically have out-of-network benefits, but if the hospital simply won't schedule appointments for Medicare Advantage patients altogether, those benefits are useless. Let me be clear about what this trend represents. Medicare Advantage plans were designed to provide lower premiums by restricting networks and managing care more tightly. For many seniors, they've seen an attraction because they often included extras like dental and vision coverage that original Medicare didn't provide. But now we're seeing a growing number of major medical centers deciding the reimbursement rates from these plans are too low. And when that happens, seniors lose access to the specialized care that they desperately need. And because underwriting requirements to switch over to Medicare supplement plans are what they are, you may have been in a Medicare Advantage plan for a while, and it could be difficult or even impossible if you have pre-existing conditions. Exactly right now why the open enrollment period happening through December 7th is so critical. If you're affected by these changes, you have a limited window to make decisions. See, losing the doctor or even losing a hospital network is not a special election period that allows you to get back to original Medicare and a Medicare supplement with no underwriting. You would still have to go through underwriting in this particular situation, unless you're losing entirely your Medicare Advantage plan, your personal plan. The complexity of navigating these changes is significant, and which providers are covering what, and the premiums in and out of pocket, and knowing whether or not you can qualify for different coverage can be overwhelming for most people. And time is running out on December 7th. After that date, you're generally locked into whatever coverage you have until the next enrollment period. And that's why I want to tell you about the Senior Savings Network, an independent brokerage that helps people look at all of the plans available to them and make a decision that's best for you. They can help you compare Medicare Advantage plans and keep your doctors in network and evaluate whether returning to original Medicare with a supplement makes sense for you, and understand the true cost of different options. But more importantly, they help you figure out if you're eligible for different types of coverage based on your health history and when you first enrolled in Medicare. I encourage you, don't try to navigate this alone. The stakes for you are too high, and the system is too complicated. Whether you're directly affected by the Mayo Clinic changes or you're worried about similar disruptions as we've covered from the other 30 major hospital systems that have announced for 2026 they will no longer take Medicare Advantage in some way, shape, or form, or maybe altogether, now's the time to get expert guidance. So contact the Senior Savings Network. Their services are free to you, completely free and no obligation. They're compensated by the insurance companies if you decide to go with one through them. It doesn't cost you any more. And you can reach them at 1-800-729-9590 or simply find them online at seniorsavingsnetwork.org. Your health is too important to leave to chance. Get the help you need to make an informed decision before December 7th. Call them now. Thanks for watching.